Hello everyone, I hope you are doing great. Today I am going to talk to you about a pulse oximeter. This is a small device, it is non-invasive and it gives you two important readings. The first reading is your pulse rate or your heart rate, and the second is the oxygen saturation level, that is how much oxygen is there in your body. Okay, both are very important readings, especially in the context of COVID-19. That is the reason why I thought I should share this information with you. Now, as you can see, in order to use this oximeter, you simply have to unclamp it like this and insert your finger into it. Now, please remember that you, especially for ladies, you should not be wearing any nail polish, otherwise the reading will not be accurate. You can insert either your index finger or your middle finger or your ring finger. Okay, either of the three. If you do not want to use your finger, you can use your earlobe. You can even attach this to your earlobe. Right? So now I am going to give you a demonstration. Just open up the device, insert your finger into it. Okay, and make sure that this device is kept at the heart level, at the level of your heart. Okay, once it is done, simply you will see a button over here, just press it. So the machine will get switched on and it will start taking the reading. It will give you 3 readings and you have to take any 2. So according to this, my oxygen level is 97 and my pulse rate is 76. Now, in order to switch off the machine, I simply have to unclamp it and leave it as it is. Okay, it will switch off on its own. I do not need to do anything else. So I can just put this aside now. And now let's come to the important part of this talk. What do these readings indicate? Let us first talk about the pulse rate. The pulse rate means the rate at which your heart is beating, right? The number of beats per minute. Now, if your pulse rate is between 60 and 100, then that is good. If your pulse rate is on the lower side, when your body is at rest, so your resting heart rate, if it is on the lower side, then that is an indication that your heart is beating efficiently, it is functioning well. If your heart rate is abnormally low, which means if it is lower than 60, or abnormally high, which means it is higher than 100, then you should immediately consult your doctor. Remember one thing, we are all common people, so do not get alarmed merely on seeing a low reading. Just get in touch with your doctor. This information is only supposed to make you aware and cautious, not to frighten you in any way. Now let us move on to the second part, that is the oxygen saturation level in your blood. Ideally, it should be more than 95%. Always. As you can see, my reading was 97 at this point. So always it should be 95 and above. Then if it is 95 and above, you can be rest assured that you are fine, you are alright. If it falls below 95, you should become alert. If it falls below 92, then immediately you should consult your doctor. Okay, this is the only thing that you need to remember. Now, why am I sharing this information with you? I am not a medical practitioner. I am not trying to sell oximeters. I am not advertising oximeters in any way. Then why am I sharing this information? It's simply because I've been reading in the newspapers that many COVID-19 patients are unable to even realize that their oxygen levels have dropped. Normally, when the oxygen levels drop, at that time we experience certain symptoms. These symptoms could be breathlessness or exhaustion, discomfort. So we would experience this. But what is happening to them is something termed as silent hypoxia, which means that they don't even come to know that their oxygen levels have dropped. In fact, there have been cases where the patients have reached the hospital and there it was found out that the oxygen level was 80% or even 75%, which is why the patients were experiencing acute respiratory distress, and they were having severe breathing difficulties. So by then it was quite a critical situation for the patients. So that is why, in order to be cautious, in order to take good care of ourselves, it is recommended, I would strongly recommend, that we should have an oximeter and we should monitor our pulse and our oxygen saturation level regularly, on a regular basis. So do this for yourselves, do it for your loved ones. Stay safe. Thank you very much for listening to me.